Hello, my name is Dr. Ominda, and in this lecture series, I'm going to discuss the anatomy of the nasal cavity and the paranasal sinuses. So the nasal cavity extends from the nostrils in front and posteriorly to the nasal apertures, or what we call the choana, behind. So from the nostrils to the choana, and after that, the nasal cavity is actually open into what we call the nasopharynx, which is the first superior part of the pharynx. So what are the boundaries of the nasal cavity? The roof is divided into three, okay? The frontonasal portion, ethmoidal and sphenoidal. So you have the frontal bone, nasal bone, ethmoid and sphenoid. Those form the roof of the nasal cavity. The floor is formed by the palatine process of maxillar and horizontal plates of palatine bone. The medial wall is formed by the nasal septum, while the lateral wall is formed by three bony plates, which we call the concha, which usually project inferiorly. So the roof, you have part of sphenoid bone, frontal and nasal bone. The lateral wall formed by the concha, you have superior, middle, and inferior concha, and these are separated by meatus that are in between the superior meatus, the middle meatus there, and inferior meatus below. Then the medial parts of the nasal cavity is formed by the nasal septum, which is not in this section, and the floor is formed by palatine process of the maxillary bone and horizontal plate of palatine bone. So this is the nasal. This is the choana that is the posterior limit of the nasal cavity, and after that you get to the pharynx, the nasopharynx. So this is nasopharynx here. The nasal septum is what divides the nasal cavity into two chambers, and it's made up of anteriorly the bony cartilage that articulates with the bony septum. So anterior part of the nasal septum is cartilage, septal cartilage. Posterior part is made up of bone, two bones, perpendicular plate of ethmoid superiorly and the vomer inferiorly. We have what we call sphenoethmoidal recess. Sphenoethmoidal recess. Here it is. This portion here is the sphenoethmoidal recess, and it's a small area above the superior concha. So this is the superior concha here. So this is the sphenoidal recess, and it usually receives the opening of the sphenoid air sinus, and this is the sphenoid air sinus. So this portion here is the recess, and it receives the opening of the sphenoidal air sinus. Then we have a superior meatus. This is below the superior concha, and it receives the opening of posterior ethmoid sinus. So this is your superior concha. This is superior meatus that receives posterior ethmoid sinus, the secretions from posterior ethmoid sinus. The middle meatus leads to the ethmoidal infundibulum. So before you get to the middle meatus, there's an ethmoidal infundibulum that usually drains the frontal sinus. So you find that the frontal sinus will first open into the groove, the semilunar hiatus, which is a groove above. So from the ethmoidal infundibulum through the semilunar hiatus, the sinus finally opens into the middle meatus, into the nasal cavity. So the middle meatus receives secretions from three paranasal sinuses, from the frontal sinus, from maxillary sinus, and anterior ethmoidal. Frontal sinus, maxillary sinus, and anterior ethmoidal sinuses. So those drain into the middle, to the nasal cavity through the middle meatus. But remember, they don't drain directly. We have what you call ethmoidal infundibulum and semilunar hiatus that will direct these secretions into the middle meatus. So this is the middle meatus here below the middle concha. So the middle concha has been resected for you to see the middle meatus, and this portion here is the hiatus semiluraris. So you can appreciate the opening of maxillary sinus here. Then that's the ethmoidal bulla, which is also referred to as the middle ethmoid sinus. The inferior meatus lies below the inferior concha. and it receives the opening of the nasolacrimal duct. So you have tears from the eye, they get into the nasal cavity through the inferior meatus that lies below this is the inferior meatus below the inferior concha. They've resected the inferior concha here. So this is the inferior meatus, and you can see the opening of the nasolacrimal duct. So the nasal cavity is lined by mucous membrane. Towards the vestibule, the anterior part of the nasal cavity, it's actually stratified squamous epithelium and the presence of coarse hair. So it's skin with coarse hair. And then as you go above the roof of the nose, above the superior concha, you have olfactory mucosa. This olfactory mucosa contains olfactory nerve cells that are able to perceive smell. The lower part of the nasal cavity is lined by respiratory mucous membrane, and the respiratory mucosa is pseudostratified columnar ciliated with goblet cells. Usually there's a large plexus of veins in the submucosa of the nasal cavity. And remember, these vessels help to humidify air. So as you breathe in, you're able to warm the air. So the mucous membrane, below it you have venous plexuses that help to warm blood, and then mucus that is able to trap foreign particles. So these particles usually, eventually, you clear you'll swallow them, and they're destroyed by the gastric acid. So as the particles go down, they'll be directed into the GI and will be destroyed by gastric acid. So what is air conditioning? When you breathe in, the air has to be prepared to get to the lungs without causing any effects. So you need to warm the air, and the venous plexus in the mucosa will help to warm the air. Then conditioning also involves moistening of the air and cleaning of the air. So the mucus helps to moisten and clean, and you also have the hairs in the nose. They help to trap particles, and you're able to warm. So warming, moistening, and cleaning are what you call air conditioning. What's the nerve supply of the nose? At the roof, towards the cribriform plate, we've said you have the olfactory epithelium. So you have olfactory nerves for smell. But the posterior inferior part of the nasal mucosa is innervated by maxillary nerve through nasopalatine and greater palatine nerves. Nasopalatine innervates the nasal septum, while greater palatine innervates the lateral walls of the nasal cavity. We also have the anterior superior portion of the nose. This is supplied by ophthalmic nerve through its anterior and posterior ethmoidal nerves. So sensory innervation of the nose anteriorly, anterosuperiorly, ophthalmic nerve through anterior and posterior ethmoid nerves, and posterior inferiorly you have maxillary nerve that will give nasopalatine nerve to the nasal septum and greater palatine to the lateral wall. So this just shows you the anterior ethmoidals. This is olfactory epithelium with olfactory nerves for smell, and this is posterior inferior where you're getting branches from maxillary. So you can appreciate nasopalatine nerve and greater palatine. So olfactory nerves here, then anterior ethmoidal from ophthalmic will innervate here, and you have nasopalatine from maxillary giving branches to the posterior inferior part of the nasal cavity. What's the blood supply of the nasal cavity? Just like the medial angle of the eye and the scalp, the nasal cavity is a site for internal carotid and external carotid artery communication. So which branches are from internal carotid? Anterior ethmoidal and posterior ethmoidal come from ophthalmic artery, which is from internal carotid artery. Then the rest are from external carotid artery. So you have sphenopalatine and greater palatine, which are branches of maxillary artery, and septal branch of superior labial, which comes from facial artery. Maxillary artery and facial arteries are branches from external carotid artery. Therefore, the nasal cavity, or rather the nasal septum, is a site for internal and external carotid artery communication. So you can see these are the blood vessels around the nasal septum. So superiorly, anterior and posterior ethmoidal from ophthalmic, which is from internal carotid, and then the other aspects, you have branches from maxillary, the sphenopalatine, and also superior labial from facial, which are from external carotid artery. So that just shows you sphenopalatine, okay, from maxillary. That's what you can appreciate in this image. What's the lymphatic drainage of the nasal cavity? The vestibule, which is the anterior portion, will drain in the submandibular nodes, submandibular lymph nodes. The remainder of the nasal cavity drain directly into the upper deep cervical nodes. So submandibular and upper deep cervical lymph nodes drain the nasal cavity. So then we have paranasal sinuses that are housed in the bones of the face. You have maxillary sinus, frontal sinus, ethmoid sinus, and sphenoid sinus and ethmoid sinus, and these are housed in the corresponding bones. These sinuses are lined by mucoperiosteum, and they're filled with air and lined by mucous membrane. They communicate with the nasal cavity through the meatus in the nasal cavity. Remember, maxillary and sphenoidal air sinuses are usually present and rudimentary at birth, but by 8th year they start enlarging and they become fully formed in adolescence. So a child is born with maxillary and sphenoid sinuses, which are present though rudimentary at birth. So this is the skull bone of a child. So this is your maxillary air sinus that is shown here. This is the position of frontal air sinus. Green is ethmoidal. Sphenoid air sinus is within the sphenoid bone, and then maxillary sinus in the maxilla. This is a radiograph showing the presence of your sphenoid sinus here, maxillary sinus, frontal sinus. Remember, air appears black on radiograph, so that's why you see air in the nasal cavity, maxillary sinus, sphenoid sinus, frontal sinus. They will appear dark. Where do these sinuses drain and how do they drain? So they produce mucus, and through the ciliary action of columnar cells, this mucus is able to move into the nose. Apart from this ciliary action, there is also the siphoning effect. Okay, so when you blow the nose, the pressure that you create in the nose, it siphons mucus from the paranasal sinuses. And what are the functions of paranasal sinuses? They increase the resonance of voice. So they increase the resonance of voice, and they are able to reduce the weight of the skull. Now, remember, when the apertures of the sinuses are blocked, when you have obstruction of mucus flow or mucociliary clearance from the paranasal sinuses, they become filled with fluid, mucus accumulates, and that is going to affect the resonance or quality of voice. So maxillary sinus is a pyramidal shaped air sinus in the maxilla. What are the boundaries? It has an apex that extends to the zygomatic bone, a base that forms the inferior parts of the lateral wall of the nasal cavity, and the roof of the maxillary sinus is the floor of the orbit. And the floor of the maxillary sinus is formed by the alveolar of the maxilla bone. So this maxillary sinus usually opens to the nasal cavity through the middle meatus via the hiatus semilunaris, and it's innervated by superior alveolar nerve. So this is the maxillary sinus. It's located here. So the roof is the floor of the orbit, while the floor is the alveolar processes of the maxilla. And remember, it's pyramidal in shape, and the apex is faces laterally at the zygomatic bone, while the floor is close to the lateral wall. The base, is close to the lateral wall of the nasal cavity. So the frontal sinuses are within the frontal bone, posterior to the superciliary arches and the root of the nose. They're separated by a bony septum, and they drain through the middle nasal meatus through ethmoidal infundibulum and hiatus semilunaris. They're innervated by supraorbital nerves, which are from ophthalmic division of trigeminal. The sphenoidal sinus is within the body of sphenoid bone, and they open through the sphenoethmoidal recess, which is located above the superior concha. They're supplied by posterior ethmoidal arteries and nerves. So this is your sphenoidal air sinus, and it's opening within the sphenoethmoidal recess. The ethmoid, there are 3 anterior, middle, and posterior ethmoid sinuses within the ethmoid bone, and they're innervated by an isociliary nerve, and they're usually spread infection can come from ethmoid sinus into the orbit. Okay, so